Hey, good evening. It's May 4th. This is Tim Ash, President of the Vermont State Senate, here with my nightly COVID-19 response update. And I'm going to provide a few updates about where things stand with Vermont's current positive test numbers, what some of the trends seem to suggest moving forward. Talk briefly about some updated guidance from the governor to our healthcare providers and what that means for normal course of business for people who need health services. And then I'm going to talk a little bit about what this whole crisis has done as we look forward to passing a state budget for next year. It will sound slightly technical. I will try to keep the numbers to a minimum. Much of it, there will be themes that will, I should say patterns, which will be pretty straightforward for you to follow along because they're all negative and pointing down, unfortunately, but we'll get there when we get there. I want to begin by saying that my last update, which was on Friday, we had a grand total of 886 positive tests in the state of Vermont to date. As of today, we have had 902, so an additional 16 cases over the weekend that we've had up till today. Also, want to talk about a trend which is continues to go in the right direction, which is right now there are only 15 people who are hospitalized and they have tested positive or they are suspected to have COVID-19. Over the course of the last 2 months, when I've given these updates, that number has typically been about 75 or so at any one time. These are obviously the most serious cases with the worst symptoms and the greatest risk of loss of life or long-term damage. So the fact that we're at about 20% of what we were hovering at the pandemic's worst moment to date is a very encouraging sign. One of the primary reasons that the state made so many took so many urgent actions was to make sure that our healthcare system wouldn't get overwhelmed and that we would have sufficient ICU beds, ventilators, and other equipment to meet people's needs if there was a sudden surge. When we've seen the most horrible news around the country where hospitals have struggled to meet the patient demand, it's largely been because the surge that hit them exceeded their capacity to meet patients' needs. So the fact that we're down to 15 patients doesn't mean we're out of the woods, but it does mean that our hospital capacity has been largely sufficient to meet the need, and that many of our preparations and things we did on a contingency basis were not needed, but were still important to do. I'm thinking specifically about the surge facilities in St. Albans, Barrie, UVM's Patrick Gymnasium, and at the Champlain Valley Expo. And I'll get a little bit in a second about the modeling moving forward, but I do think that that's positive news and speaks to why the governor is making some changes that I'm going to talk about now. So one of the things that the hospitals began to do in Vermont, and then the governor, I believe in one of his orders, formalized it so that all hospitals were working on the same operating principles, is something meant to preserve as much capacity to meet people's needs as possible. So all what are called elective procedures and surgeries had been postponed about a month and a half ago. The idea is that we did not want much needed hospital beds to be occupied by people whose procedure could possibly wait a few months. It wasn't life-threatening. It wasn't a super urgent case like a heart attack, but something that could rightfully be postponed until a safer time. Today, the governor announced that outpatient clinic visits, which are most of what people do when they go to a doctor's office, diagnostic imaging, and outpatient surgeries and procedures, meaning you go in, you get the procedure done, and then you're out, and don't need to take up a bed usually overnight, that those will be allowed to commence once again with some conditions for the various providers who perform these procedures. So the first off, the social distancing must continue. So if you have a waiting room, the chairs have to be separated by 6 feet in every instance. Only the minimum number of people required to perform a particular procedure or do a checkup are allowed to be in any one room at any one point in time. The facilities are required to test every patient or guest of a patient that comes in before entry to make sure that they've been screened and tested, or I should say screened for COVID, and also that their staff, the same thing, so that we can control any potential outbreak before something gets set off by letting someone into a facility where it will spread like wildfire. And then lastly, the facilities are asked to minimize the number of hospital beds that are being used at any one time to continue to have the capacity, should we need it, for a surge in COVID-19 cases. So this is a sign that our healthcare facilities feel pretty confident that they will be able to safely allow people to come and go in the facilities. They will still be taking an extra level of care to make sure that people aren't unduly risking others or themselves. But it starts to return some of the normal business to some of our healthcare facilities and hospitals. You may know that most of them are struggling financially right now in very, very severe ways because they weren't having elective procedures occurring for the last 2 months, which is one of the activities which I think generally is profitable for hospitals. By not being able to do that, but taking on cases that were absolutely vital to take on, but lost the hospital money, it meant that it was like a double-edged sword financially. This is not being allowed for financial reasons. It's being allowed because the state believes it can be done safely, and we'll hopefully see positive outcomes as people start to return to their healthcare providers wherever they are. Before I turn to the most daunting financial situation for a state budget that I've encountered in more than a decade, I want to say one last word about the state's modeling. So about a week or so ago, I had Mike Pichak, the Commissioner of Financial Regulation, on talking about the way the state was using data to help inform the decisions about what type of activities to permit, which ones should not be allowed, to make sure that we're keeping track of how compliant people are with the social distancing order, how many people are still moving around a lot versus staying at home. And I would recommend you go back and watch that. Modeling and number crunching isn't the most exciting sounding topic, but it was actually very fascinating to hear how Mike and his team have been using data to help inform the governor's thinking on a lot of this. But one of the reasons why the governor is, I think, willing to do this slow opening of the economy in a very measured way is that right now, Vermont's rate of new positive cases has slowed very considerably. In the first days of COVID-19, our number of total positive tests was doubling every 3 or 4 or 5 days. Right now, it is expected that the next doubling is going to take 84 days or a full 12 weeks. That number is really an indicator of how quickly things are spreading. And so just to put that in perspective, first month or so, we were seeing doubling every 3 or 4 or 5 days. Now we expect that it'll be a full 12 weeks before we have another doubling of the number of positive cases. Well, standing on its own, that might not communicate very well to the person sitting at home without lots of spreadsheets in front of him or her. But to put it in context of our regional neighbors, I'll just briefly describe how our doubling rate compares to the other states. So, as I said, in Vermont, we expect the number of positive tests to double in 12 weeks' time. In New Hampshire, right next door, it is anticipated their positive tests will double in just 3 weeks. So 4 times faster than Vermont's doubling. In Connecticut, it will double in 4 weeks. In Maine, 4 weeks. In New York, 4 weeks. And then most concerning of all, I mean, all of this is very concerning, but in Massachusetts, it's expected to double in just 2 weeks, and the same with Rhode Island. So that doesn't mean that it's still not very serious and that people, when they are infected, aren't at great risk, and that we still don't have the possibility of a resurgence of cases and much more suffering possibly ahead. But compared to all of the states in the Northeast, it means that the social distancing and stay-at-home efforts and people's compliance with the public health orders and maybe some natural features of the state of Vermont are resulting in a far, far slower spread of positive tests at this point. So sometimes I'll get someone will contact me and say, why is the governor allowing this thing or that thing to happen? If it weren't for those very positive trends that we're seeing, I don't believe the governor would be willing to do that. So we'll keep monitoring all that information. All of our decisions should be based on what's really going on in terms of the spread of this infection. And hopefully the signs will continue, or the signs will continue to be positive, and that we'll move in the right direction. So now I want to turn my attention to my key topic for the day. This is a bit, it's very COVID related, while it's not a public health related message. And this is about the financial situation the state is in right now. And I will just tell you, it is bleak. And the fact that all the other states are facing the same misery doesn't make it any less miserable. When I first arrived in the Senate, it was really the middle and later days of the Great Recession, when state governments everywhere were really, really struggling mightily. And but times right before that had been pretty good. From a financial point of view, it had been the late 2000s. There had been a pretty significant ramp up of income in the state, and so there was a little bit of cushioning of the blow. Now we're seeing some drops in expected revenues for the state budget that are really they're challenging, they're troubling, they're scary, and we'll find a way through it. But I wanted to take a minute to describe just how deep the financial problems are going to be. So what I'm about to say is more meant to be an insight into how the legislative process works, not a attempt to convince you to become a public economist. But let me begin by saying that each year the state budget runs from July 1st to June 30th, which means that beginning April 1st, we were beginning the fourth quarter of the previous fiscal year. We normally make some slight tweaks to that budget in January. The legislature comes back after 6 months away. We learn some things from when we passed the budget. Maybe we need to make some tweaks. We get some money from the federal government. So we make some minor adjustments. We call it the budget adjustment. It usually passes unanimously or almost unanimously. It's mostly small technical changes and some accounting changes that we have to make. Well, it's very rare, in fact, I've never seen it, that this late into a particular budget year, we would be required to do another budget adjustment. And that's because we expect in this quarter, from April 1 to June 30th, that the state budget will be short $143 million. And I don't mean to be dramatic by saying that, but it is a huge sum of money. What are those reductions that we're anticipating for this quarter? There's really three areas where we will see reductions just for April to June. And then I'm going to talk about the whole next year in a second. Our general fund, which pays for a lot of the basics in state government. When I say the basics, it's like the Department of Children and Families, our tax department, our HR department, Many of our environmental programs receive some federal money, but a lot of state money. It's human services programs, support for the elderly, support for low-income people. A lot of these are what we call our general fund. It's supported by income taxes, largely corporate income taxes, rooms and meals. And just for the next 3 months, we expect those funds to be down $48 million. Our education fund, which pays for our K through 12 education system as well as pre-K, is going to be down $54 million just for the next 3 months. $54 million is like multiple cents on people's property tax bills for those who pay a property tax rate. It would be the equivalent, I think, of 6 or 7 cents of property tax increase just for a quarter of the state fiscal year. So the education fund, which pays all of our schools, down $54 million. And then our transportation fund, $41.4 million down just for 3 months. Our transportation fund is like a self-contained unit. All the taxes for gas taxes and diesel taxes and some of the purchase and use tax, which is like the sales tax for when people buy cars and trucks, all that money goes into a transportation fund where it gets used for road projects, paving, fixing infrastructure like bridges and culverts, supporting alternatives to motorized vehicle, whether it's bicycle and pedestrian pathways or municipal projects that help people safely get to school or through downtowns and villages. But that's down $40 million just for the fourth quarter. You can imagine fewer people driving around, almost no one buying vehicles because you can't even do it legally right now or haven't been able to. So $40 million down. So the plan, I wish there was a blueprint for this that we could just pull out and everything would be easy. But what the legislature anticipates doing is passing a significant modification to this year's budget at the end of May or early June. That's normally long after we've passed the budget for the next year, but the circumstances aren't going to let that happen. So there's going to be some interesting choices we have to make. We'll probably use some of our reserves. We have a little bit of what we call a rainy day fund, which will help us get through this year, and we'll make some adjustments that we hope won't really impact Vermonters in a way that anyone would notice. So we can make some movements of funds. But next year's budget, which is each year the most important thing we do in the legislature, is pass the next year's budget. And it's the only bill that has to pass each year. And it is basically the signature piece of legislation. And for next year, and I'll try to keep the numbers as simple as possible because the scale may not immediately communicate itself. But our budget each year is about $6 billion. That includes transportation, education, and everything else in state government, healthcare, Medicaid. And a good chunk of that, maybe a third or more, is federal money. So the federal government sends all sorts of money to support our healthcare programs, transportation, and a lot of other things. The rest of it is made up of local taxes. We expect right now that for next fiscal year, we will be short $427 million. So $427 million is a number that you don't solve by, looking under the mattress, under the couch cushions for, spare change. It's a huge number. I mentioned these 3 funds before: our general fund, which pays for a lot of general government, education fund, which is K through 12 and pre-K, and then the transportation fund. The being down $427 million, what that means, and maybe the percentages are more helpful, that for our general fund, it's a 16.7% reduction in the money available to pay for general government. For our education fund, it's a 19.7% reduction in the funds for K through 12. And for transportation, it's a 16.8% reduction in the money available for transportation projects and transportation infrastructure and transportation policies. That is a daunting series of challenges that we have. And one of the things that's making it particularly difficult this year is that it's not clear when things will start to improve financially. For instance, if we have another outbreak and bars and restaurants and retail outlets and hotels, if they're all not able to operate under normal conditions, let's say until the fall or beyond, that will make these numbers I've just described worse. On the other hand, if things are allowed to open up quicker because the virus has effectively been suppressed, if that were to happen, the numbers might get better. So it's very difficult to write a budget if you don't know exactly what numbers you're going to have to work with. Typically, we would be able to pass the budget in May, go home, and then wait till January to figure out if we need to make adjustments. Well, the scale of these swings in revenue and tax money to the state are so dramatic that that is not an acceptable way to write the budget. So this year, we expect we will not be able to write a full budget until as late, well, maybe, I don't know if it's as late or as early as August. So the legislature is not hardwired to be in Montpelier after May. And what we will probably do is do some work through May and then maybe take some time off, a month and a half, come back and do the final budget. This is a very weird situation we find ourselves in, and I'm not seeking sympathy for legislators, but obviously what we do is primarily try to make government work for all of you. And so we need to have the best information so we can make the choices. And in some cases, we'll have to make sacrifices to really do right by the people who've elected us. And I just want to make one quick note. I do find some similarity to back in the Great Recession. And there was a proposal at the time to eliminate the state's annual investment in land conservation. And I remember saying at the time that it is precisely in difficult times that you really know what you value and what your state values. And we were able to defeat that proposal to cease investing in land conservation. I'm very glad we did. But that type of question is going to present itself to us in many different ways. What are the core things that we believe strongly as a state must be supported? What things can wait? What things will get cut? What things should we add to? Those are all difficult choices under any circumstances, all the more difficult when you're doing it with a $427 million revenue reduction, which is what we're facing. A couple last stats, and I'll put the spreadsheet up that I'm using. I'm drawing this from under the comments for this video. But you may say, well, what are the primary reasons why we expect to have so much less money coming in? And again, I think percentages are more helpful than the grand totals, because sometimes it's hard to really keep in perspective what 427 million means, or 10 or 30 million. Personal income tax, we expect to be down 17.8% next year. Corporate income tax, which is a much smaller portion of the state's revenues, is expected to be down 37.7%. Just numbers which 6 months ago would have been unthinkable. Rooms and meals tax, so all the tax that people pay when they book a night at a hotel or an inn or a B&B or things like that, plus the meals taxes that people pay when they go out to restaurants, expected to be down cumulatively 40.8%. Sales and use, which is when you buy certain consumer goods, down 17.4%, which means people will be buying roughly 15 to 20% less stuff. Purchase and use, which is purchasing vehicles and trucks, 21% expected reduction in revenue there. And then finally, gas tax revenues are expected to be down 22.7%. And that is all a reflection of reduced transit, people staying at home under the stay-at-home order, an expectation that unemployment will linger, so people won't be driving to and from work as much. All of the things that get people in their cars moving around. I wish we could say it was going to be down 22.7% because everyone was going to have more fuel-efficient vehicles, but that is not the reason for this particular drop. So I don't say any of this to scare people, but rather to prepare everyone for what is going to be a 3-month journey, basically, towards a difficult state budget. And the good news is Vermont is viewed as one of the states that is in the best position. I mean, after all the things I just told you, Vermont is viewed as being one of the states in the best position to weather the storm financially, which just goes to show how serious this will be for other states who have more reckless fiscal policies, financial policies. But it's going to be a long road, and there's going to be a lot of demands on a scarce amount of resources. We will get through it. And the good thing is that the spirit right now that's animating the legislature and working with the governor's team is one of cooperation. So as we make these choices, there will definitely be disagreements, but I think we all understand the severity of it and the need to help not just balance the books here at the end of the day, but also make investments that will help us successfully grow our way out of this. So with that somewhat cheerful, well, it's not cheerful, it was kind of a dreary presentation tonight. I'm going to sign off, and thanks for joining me, and I'll see you tomorrow at 5:30.